The infection had actually tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. Oh, God.
Oh! Ew! Dude! What the
Hello, friends, trace amounts of science, and I do mean some trace amounts of science. Today, we're doing surgery. We're going into the OR to witness the Swamps of Dagobah. Yes, it's a 12-year-old story. I'm probably late to the party, but it's a classic. It's got some of that good, deep cringe, so I hope you're not eating right now. But if you are, maybe save this video for a little later, because it's going to get nasty. Maybe you've heard it before. Maybe you're ready for what comes. I guess we'll have to see. This was an AskReddit thread from 2012. Doctors, nurses, Redditors, what has been your most gory, disgusting, or worst medical experience? Mine would have to be when I volunteered as a nursing assistant at the local hospital. On the first day there, I was asked if I'd like to assist in bathing an elderly patient. I was told that he was near comatose, riddled with cancer, and was on death's door. I agreed, but nothing could prepare me for the sight of him. His pallid skin was stretched over bones, and his eyes were dull and staring. Most of his skin was purple, where his blood vessels had ruptured. He couldn't even speak, and screamed when myself or the other nurse had to roll him over. He was constantly injected with morphine because of the pain, and 2 days later he passed away. I decided that the medical profession was not for me. Yeah, there's nothing dignified about death. My wife also has a few medical horror stories, and yeah, she also decided it's not for her. Reading these stories is my weird fascination, and the edit's not really relevant. I also have a weird fascination with the cringe, but the internet was not prepared for what was laid forth by one user, Bonsai Panda. As a matter of fact, this entire thread is probably full of gold. But we'll start with the Swamps of Dagobah. How about that? And then you can hop off if you don't want anymore. So yes, OR nurse here. This is kind of a long one. I was taking a call one night and woke up at 2 a.m. for a general surgery call. Pretty vague, but at the time I lived in a town that had large populations of young military guys and also some avid crystal users, so late night emergencies were common. Yeah, got into a bit of a knife fight over in Sunderland. Go to the hospital, where a few more details awaited me. Perirectal abscess. For the uninitiated, this means that somewhere in the immediate vicinity of the a-hole there was a pocket of pus that needed draining. Needless to say, our entire crew was less than thrilled. I mean, in fairness, I'm sure that the woman that has to have her abscesses drained is also less than thrilled. So let's just both get it done so we can move on with our day and never think about it again. Oh, how I wish I could never think about it again. I went down to the emergency room to transport the patient, and the only thing the ER nurse said as she handed me the chart was, "Have fun with this one." Among healthcare professionals, vague statements like that are a bad sign. I mean, truly the only person who could have fun with something like this would be like Nurgle himself, right? My patient was a 314-pound Native American woman who barely fit on the stretcher that I was transporting her on. She was rolling frantically from side to side and moaning in pain, pulling at her clothes and muttering Hail Marys. I could barely get her name out of her after a few minutes of questioning, so after I confirmed her identity and what we were working on, I figured it was just best to get her to the anesthesiologist so we could knock her out and get this circus started. Hell yeah, chemically induced unconsciousness. She continued her theatrics the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot, though. Chronic drug abusers who don't handle pain well and who have used so much that even increased levels of pain medication simply don't touch it because of the high tolerance levels. So what you're saying is a fent addiction is sort of like a superpower?
You know what gilf means, right?
Yeah. God, I love fentanyl.
You said it, pal.
It's not true. It should be noted, tonight's surgical team was not exactly wet behind the ears. I'd been working in healthcare for several years already, mostly psych and medical settings. I've watched an 88-year-old man tear a 1-inch diameter catheter balloon out of his dong while screaming, "You never make me talk!" I've been attacked by an HIV-positive neo supporter of the tiny mustache man. I've seen some stuff. The other nurse had been in the OR as a trauma specialist for over 10 years. The anesthesiologist had done residency at a level 1 trauma center, or as we call them, knife and gun clubs. The surgeon was ex-army and averaged about 8 words and 2 facial expressions per week. And out of this grizzled crew, none of us expected what was going to happen next. Oh no.
I don't like where this is going.
It is the right team to get it handled, though. We got the little lady off to sleep, put her up in the stirrups, and I began washing off the rectal area. It was red and inflamed, and a little bit of pus was seeping through already, but I guess that was all pretty standard. Her chart had noted that she'd been injecting IV substances through her perineum, so this was obviously an infection from dirty needles or bad substances. But overall, it didn't seem to warrant her repeated cries of, "Oh, Jesus, kill me now!" Just turn your baseball hat backwards, flip the chair around, and be like, "Hey, buddy, you going through some stuff? Let's talk it out." No, the surgeon steps up with a scalpel, sinks just the tip in, and at the exact same moment, the patient had a muscle twitch in her diaphragm, and just like that, all hell broke loose. Yeah, we are earning our paycheck tonight. Brace for impact, everyone. Unbeknownst to us, the infection had actually tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. Oh, God.
Oh! Ew! Dude! What the
Yeah, that cuts me deep. Here we go. This godforsaken mixture came rocketing out of that little incision like we were recreating the funeral scene from Jane Austen's Mafia. It's a classy reference there. Jane Austen broad. We all wear waterproof gowns, face masks, gloves, hats, the works, all of which were as helpful as rain boots against a fire hose. The bed was in the middle of the room, an easy 7 feet from the nearest wall, but by the time we were done, I was still finding bits of rotted flesh pasted against the back wall. Oh, God. It's like a phallus super soaker known to man. As the surgeon continued to advance his blade, the torrent just continued. The patient kept seizing against the ventilator, not uncommon in surgery, and with every muscle contraction, she shot out more of this brackish gray-brown fluid onto the floor, until within minutes, it was seeping into the other nurse's shoes. God damn it. I guess we make enough to buy some more, but I didn't want to buy some more. Maybe at a certain point you just accept that these are your nasty, disgusting, forever stained work shoes. But that does seem sort of unhygienic. I was nearly 12 feet away, jaw dropped open within my surgical mask, watching the second nurse dry heaving, and the surgeon just standing on tiptoes to keep this stuff from soaking into his socks any further. The smell hit them first. Oh, God, I just threw up in my mask. The other nurse was out. She tore off her mask and sprinted out of the room, shoulders still heaving. And then it hit me. Mouth still open wide. Oops. Not able to believe the volume of fluid that this woman's body contained. The human body's an amazing creation. Also, a terrifying creation in some cases. The smell was like getting a great big bite of the despair and apathy that permeated this woman's life. I couldn't fucking breathe. My lungs simply refused to pull any more of that stuff in. Yeah, that's been fouled. This is the foulest of soup. The anesthesiologist went down next, an ex-NCAA D1 tailback, his 6'2" frame shaking as he threw open the door to the OR suite in order to get some more air in, letting me glimpse the second nurse still throwing up in the sinks right outside the door. Another geyser of pus splashed across the front of the surgeon. The YouTube clip of David at the dentist keeps playing in my head. Is this real life? We're not sure, son. I'm pretty sure it's a simulation. Now sit down! In all operating rooms everywhere in the world, regardless of socialized or privatized, secular or religious, big or small, there's one thing the same. Somewhere, there's a bottle of peppermint concentrate. Everyone in the department knows where it is, everyone knows what it's for, and everyone prays to their gods that they never have to use it. In times like this one, we rub it on the inside of our masks to keep the outside smells at bay long enough to finish the procedure and shower off. Some things can never become truly clean. At the LA morgue, they use Vicks Vapor Rub, so I know that'd do in a pinch too. But I really do hope to never find myself in a situation like this. I sprinted to our central supply, ripping open the drawer where this vial of ambrosia was kept, and was greeted by an empty fucking box. The bottle had been emptied and not replaced. Somewhere out there was a godless bastard who had used the last of the peppermint oil and not replaced a single fucking drop of it. To this day, if I figure out who it was, I'll kill them with my bare hands. But not before cramming their head up the colon of every last meth user I can find, just so we're even. I like that righteous anger. You must suffer what I've suffered! Perfect. I darted back into the room with the next best thing I could find. Vicks? No, a vial of Mastisol, which is an adhesive rub we use sometimes for bandaging. It's not as good as peppermint, but considering that over 1/3 of the floor was now thoroughly coated in what could easily be mistaken for a combination of bovine afterbirth and maple syrup, we were out of options. Maple syrup? Don't touch it, it's not maple syrup. I know from the smell. I started rubbing as much of the Mastisol as I could get on the inside of my mask. Just glad to be smelling anything except whatever slimy demon spawn we'd just cut out of this woman. The anesthesiologist grabbed the vial next, dousing the front of his mask in it so he could stand next to the machines long enough to make sure this woman didn't die on the table. It wasn't until later that we realized that Mastisol can give you a mild high from huffing it like this, but in retrospect, that probably is what got us through. Yeah, and the surgeon didn't take any, so probably everything's fine. But everybody else, go ahead, have a ball, why not?
You're crazy. I like you, but you're crazy.
By this time, the smell had permeated out of our OR suite and down the 40-foot hallway to the desk, where the other nurse still sat, eyes bloodshot and watery, clenching her stomach desperately. Our suite looked like the underground river of ooze from Ghostbusters 2, except dirty. Oh, so dirty. This is probably like one of the worst things everybody here has experienced, and we're all experiencing it together. These are the bonds that never break. A family that cringes together stays together, isn't that right, Jerry Army? They know. You should join the Jerry Army, either over on Patreon or the YouTube memberships with the join button down there. Anyway, OP says I stepped back into the OR suite, not wanting to leave the surgeon by himself in case he genuinely needed help. It was like one of those overly artistic representations of a zombie apocalypse that you see on fan forums. Here's this one guy in blue surgical garb standing nearly ankle deep in lumps of dead tissue and fecal matter and several liters of syrupy infection. He was performing surgery in the Swamps of Dagobah. Except the swamps had just come out of this woman's ass and, yeah, Yoda didn't bother to show up. Disgusting this is. Leave I must. He and I didn't say a word, for the next 10 minutes as he scraped the inside of the abscess until all of the dead tissue was out. The front of his gown, a gruesome mixture of brown and red. His eyes squinted against the stinging vapors originating directly in front of him. I finished my required paperwork as quickly as I could, helped him stuff the recently vacated opening full of gauze, taped this woman's buttocks closed to hold the dressing for as long as possible, woke her up, and immediately shipped her off to the recovery ward. Well, thank God that's over. Never do this to us again. If you are trying to get clean for you, just do it so nobody ever has to live through that again. Until then, I'd only heard of alcohol showers. Turns out 70% isopropyl alcohol is about the only thing that can even touch a scent like that once it's soaked into your skin. It takes 4 or 5 bottles to get really clean, but it's worth it. It's probably the only scenario I can honestly endorse drinking a little bit of it as well. Yeah, that's good for your tummy tum. Why not? It's gonna take a Justice League of substances to scrub this from my head. After we left the locker room, the surgeon and I looked at each other, and he said the only negative sentence I'd heard him utter in 2.5 years of working together. That was bad.
Well, no f***ing shit.
The next morning, the entire department, a fairly large floor within the hospital, still smelled. The housekeepers told me that it took them nearly an hour to suction up all the fluid and debris left behind. The OR suite itself was closed off and quarantined for 2 more days just to let the smell finally clear out. I laugh now when I hear new recruits to healthcare talk about the worst thing they've seen, 'cause you ain't seen shit, kid. TLDR, don't shoot illicit substances through IV into your taint. Advice for life, OP. Yes, that's very true. I guess after the Chris Trucker saga, it's hard to get me, truly disgusted anymore. But Swamps of Dagobah is able to do it. The OP is just so good at describing things. What was the brackish gray-brown fluid? So foul. And this is, of course, why it is a Reddit post of legend. Now, I could end the video there. I don't think anything's ever going to top the Swamps of Dagobah, but I do want to dig through this Reddit thread while my mind is on it. Some are horrific, some are just plain sad, but we'll see what sort of grab bag we get here. User Wolfbriar says, ERRN here. This, so far, is the only death I've experienced from work that I've lost a significant amount of sleep over. 24-year-old male walks into the ER with complaints of a flu-like symptoms for the past 3 days. He's decided to come in that day because he started to develop a rash throughout his body that he was unfamiliar with. Sadly, this rash was actually the result of a failed battle with bacterial meningitis, causing him to bleed internally and externally. By the time we got him to the ER, he started crying blood, and the terror in his eyes was palpable. He went downhill fast. His lucidity diminished with his blood pressure, and the last thing he said before succumbing to pulseless VTAC was something about his mother that we couldn't make out. You could see his consciousness fade from his eyes as we started compressions. The code lasted close to an hour. Yeah, he's 24, man. Nobody wants to lose him. Not at 24, Jesus. Told you it'd be sad. At first, we could still keep his oxygen levels up with mechanical ventilation, defibrillation, and drugs, but blood was filling his airways faster than it could be suctioned out. He was bleeding too fast for any medications or fluids to keep his blood pressure up. He died, soaked in blood and nearly unrecognizable due to his now almost uniformly purple skin and swollen face. We later found out that he was studying neurobiology, had a devoted girlfriend that was, for all intents and purposes, a fiancé, a large family, many friends. He was an athlete who lived healthy. He had beautiful curly hair. This made the death tragic in a way that you just don't experience when an 80-plus-year-old dies. It made the unanswered pleas to God for help that had been sent echoing around the room by his family all the more bitter. I helped drag and push him into a body bag. Holy crap, dude. What a downer, But again, like I said, death is not dignified. The medical profession Yeah, it takes a certain sort. Bacterial meningitis, that's so random, man. What a tragedy. You have, just some flu-like symptoms, and then it all spins out of control like that because you didn't catch it early enough. I am officially more paranoid about bacteria than ever. I'm already kind of germophobic, but yeah, that's about the worst germ that you could ever catch, I think. It attacks the meninges in your brain. I don't know what they do, but probably every part of your brain's important a little bit. You don't want it to get infected. Good God. We'll try our luck with another one. Deleted user. My dad's been a nurse for nearly 20 years. He's moved around from working in the ER to radiology and now into the ICU. He's one of the most well-respected nurses in the hospital. I would know because I worked at the same place as a phlebotomist. Anyway, our hospital is a bariatric center of excellence, so you know what that entails. Some pretty big patients. So this one day, I go up onto the 4th floor in the neuro unit to get a blood draw, and as soon as I step off the elevator, I smell shit. Just really foul, rotten egg smell. That's sick people poop, isn't it? I don't think much of it as the hospital is older and poorly ventilated. I know, right? Yes, I do know, right, OP. I've been in the Philippines for far too long, though. I see something like that, I'm like, that's a minor issue compared to the cats walking around the hospital near my house. There's like 5 cats that just live in there. Don't worry, they're getting rid of the mice. Okay, cool. OP continues, when I get home, I asked my dad about it since the ICU is on the same floor. They said they had a guy in who was 550 pounds in the unit, and he was having some abdominal pains. Turns out that he hadn't had a bowel movement in almost a month. Oh no. How many pounds is that? Do you have to plunger it out of there, or manual extraction, God forbid? Before he was transferred to our ICU, other clinics had tried to give him a few enemas, but to no avail. So my dad is saying that he's putting one of those balloons into the guy's butt so he can detach a bag, like a catheter, and he turns around to check a monitor and he hears this dripping noise behind him. Oh no, the floodgates. Turns back around and there's just a river of shit falling from the bed. The entire floor is covered in a month's worth of poop, dripping, splashing all over everything, including my poor dad. He and all the nurses roll up their scrubs like they're going clamming. You don't want to get bare skin? Come on. I guess skin washes off easier, maybe. After an hour or so, they finally get this guy cleaned up. Housekeeping stopped by and just left the cart for them and said, nope.
This shit, I'm out. No thanks.
That's fucked up. The Dagobah people cleaned up something worse. Got bougie housekeeping at this hospital. I guess right after they finished cleaning it, it happened again. Yeah. Round 2, you thought that was all he had in him? Look at him, he's a big boy. I don't even want to imagine the smell in that room if it was enough to stink up the entire 4th floor. I can't begin to describe the respect that I have for nurses. Just facts. Like I've said throughout this video, it takes a certain breed. I am not one of that elite crew. I'm just like, I don't know, dude. I want you to feel better and stuff, but like, this is a bit too up close and personal. Here's another one from user Amatrini. A few that stand out are a man with no dong, a prolapsed rectum, Google image if you dare. Don't do it, don't do it, don't listen. Debridement of a limb that smelled so horrible that you could smell it from the time you stepped into the A&E. Maggot-infested wounds, bed sores that were so deep that you could see the pelvic bone, among other things. Jesus. What kind of horror show are we running here? Also, edit, just remembered this story, was observing pediatric cardiac surgery on a young infant girl who had been having recurring problems with breathing. Oh no, man. It's gonna end with a sad one. It's like vaguely gross at first, and now it's just sad. All sad. Investigations showed that she had a heart defect. However, when she was opened at surgery, they realized that her condition was more extensive and complex than expected. Her multiple heart defects would make it difficult, if not impossible, to operate on her without causing more harm than good. I remember seeing the surgeon just looking at her for a long time, seemingly thinking or analyzing the situation in silence. After about 5 minutes or so, he just shook his head and started closing her up. I never found out what happened to that little girl afterwards, but that event stuck with me ever since. Oh, also I'm a final year med student, in case anyone was wondering. Yeah, that's messed up. It probably didn't go too well for that kid, but you never know. Kids are pretty elastic. Kid loses half his brain and the other side's like, that's fine, we'll just make up for it. So I don't know. You only have like one heart where there's two lobes of your brain, so maybe it's a less hopeful situation, but I like to think that kid pulled through. At least that's what I'm going to tell myself to keep my mental health up. What I really need is a funny one, goddammit. Give me a funny one. Lol My Life says, I'm a nursing student. We just finished our first clinical placement at a nursing home. Not me, but my friend did something ridiculously funny. She was dressing a man, and while pulling his pants up or down, not sure which, he started to do a really big poo. So she put her hand out under his butt and caught it.
Nice catch, Percy.
Just log toss it in the trash. The other nurse starts laughing her head off at my friend standing there with this huge shit in her hand. She asked her why she didn't just let it fall to the floor, and all she could say was, I panicked. I didn't know what to do. I thought I had to catch the poop. Did I do it right? Edit. Okay, it doesn't really fit the description, but I had to tell someone. I'm glad you shared it. I needed that. Nurses always coming in clutch, man. Catching handfuls of poop, man. Whatever they need to do to get the job done. Emily Dean says, the very last patient I saw in my internship came in with a cyst in her pubic area. Oh, there's a lot of pus. Think to myself, okay, seen plenty of these. No big deal. I walk in to find a cyst the size of a jawbreaker. Oh, that's a lot of pus. It was purple and practically had a face. We had to lance it, so we needed some local anesthetic. When the syringe touched the cyst, the whole thing blew open with pus. Oh, no. The smell in the room was terrible. Upon pushing on it further, the cyst made a sound as it released more pus. It sounded like basketball shoes on a freshly waxed floor. Oh, it's like a squeaky sound? I was hoping it would be farty. Oh well. The core of the cyst was about the size of a dime. Love this kind of stuff, and I'm considering going into dermatology. Oh yeah, my wife gets into a string of those Facebook videos. She's like, it's Dr. Pimple Popper. I'm like, it's disgusting. Don't show it to me. I could read about it. I think I read about these things just fine these days after years of doing it. But the visual component, yeah, that's what always digs me real deep. Willow JR says, this kind of doesn't fit the topic, but kind of does. My mom used to work at a teaching hospital in the perfusion department. This meant students held a pig lab where they would practice their work with pig blood. Now, there's some sort of flushing process that occurs with the blood. I'm not really sure how they dispose of it. Well, construction crews were nearby building a new facility, and one of the workers must have hit a pipe because this blood starts spewing everywhere. Yeah, that's metal as fuck. Slayer just pops out of nowhere. Raising up out of the sewer grates. I love it. All we need is a tower of flame and a goat skull and we'll be in business. My mom gets a frantic call because the workers thought that it was human blood, which would have been much more dangerous. They were told the situation, but I'm sure there were lots of pants shitting around the site that day. Oh, you mean it's just pig blood, bro? You mean it's safe to drink? Standing outside with my mouth open wide. You guys know? You guys know that song? Core memory, courtesy of Barney the Dinosaur. Anyway, this OP deleted says I have two, med student here. One, a super obese, that's an actual medical term. Oh, thanks. A woman comes into the clinic complaining of a foul odor that she's noticed. Uh-oh. And yeah, me and the attending noticed it too. It was a smell somewhere between rancid milk mixed with rotting fish and a disemboweled skunk swimming in garbage. It's not good. Whatever's going on is not good. We do the usual workup, take a good history, do a thorough physical, as best we can, given that she is huge and has folds and folds of fat and skin draped all over her. Yeah, just dig deep enough in the fold, I'm sure you'll find the problem. You forgot to baby powder your crevices. If you're big like this, you can't be out here sweating all over like that, got it? Case closed, you're welcome. We also included a downstairs exam, just in case there was some funky down there growth, and we ran some simple labs. As me and the attending are discussing how we have no clue what's going on, the nurse comes out holding a green, soggy mush in her gloved hand and waves it in front of our faces. I nearly puked right there. Turns out the woman was using pieces of bread to soak up sweat by putting them in between her fat folds. Ugh. What?
Why would you do that? Why would you do any of that?
I was joking about the baby powder thing. The baby powder thing works. Why would you use bread? She gonna eat it later? I am so mystified. Apparently, she just forgot about one of the pieces, which then stayed there to marinate in her juices for weeks, as estimated by the patient. I was sent in to see if there were any more hidden pieces. Luckily, there weren't, but having to lift up and search every fat fold was as embarrassing for her as it was disgusting for me. At least she has the common sense to be embarrassed, but yeah, I think the real question I'd ask is why? Why bread?
The evil seed of what you have done germinates within you.
I just like to pull out the salty, soggy crackers at the end of the day. My body made this for me. It's called recycling. It's nasty. Story number 2. A guy was drunk, fighting with his girlfriend, and then decides to light up some M80s and throw them at her. What the fuck? This is completely outside my frame of reference. You know, my parents used to throw dishes. Before the divorce and whatnot, they had some real knockdown dragouts, but the same has not happened for me and my wife. We seem able to talk everything through. And that's good, because once you throw something at your partner, the respect is gone. If you're throwing M80s at your partner, yeah, pretty sure that's attempted murder or something. Assault with a deadly weapon, at the least. Well, he waits too long after lighting one of these things and ends up blowing off his hand. Karmic justice. He's brought to the ED completely drunk and having lost a lot of blood. We stabilize him and take him to the OR. While the hand surgeons are cleaning off his stump of a hand, me and the surgery resident are fixing all his chest wounds. One of the hand surgeons says, "Wow, this is a mess. Did anyone at the scene find his thumb?" No one knows. We continue examining, cleaning, and suturing his wounds, and lo and behold, buried in a deep wound in his upper abdomen is 2/3 of the guy's thumb. If he hadn't been so fat, his thumb would have likely entered his peritoneum, which is, of course, a smooth tissue membrane that lines the abdominal wall and covers most of the abdominal organs. We are learning so much today. TLDR, super obese woman uses bread to soak up sweat in between her fat folds and forgets about a piece that eventually starts rotting and smelling so bad that she comes to the clinic complaining of a foul odor of unknown source. 2, guy's too slow throwing a lid M80 and ends up blowing his thumb off into his own belly. What are the odds of that, you know? I guess pretty good. Your thumb's often pointing towards you when you're holding things. I like how both of these stories are about people hiding things in their fat folds, but like in slightly different ways. If I get fatter, I could start doing this. I hope I never get to the point where I could start doing this. I'm still hungry, so let's do some more. Redbook123 says, I saw a man just after he was burned in a boiler explosion. His skin hung in strips off of his body, as if it had slipped off, like how easily the skin of a tomato slips off after it's boiled. Underneath was glistening pink and red flesh. The room smelled of cooked flesh and mechanical grease. The poor man was aware and moaned/screamed in pain. It was terrible. Yeah, I'd imagine so. Take a human, boil them alive. Imagine what that sounds, look, and smells like. No, thank you. That is a nightmare. I'm sorry that he had to go through all that. Did he live? Science is amazing. He probably lived. Here's another one. I want to tell this story because I feel like there is very limited knowledge about when it is appropriate to withdraw care on your family. If any of you take anything away from this, please write a living will and talk to your loved ones about your wishes. Yeah, my wife already knows. It's fine. A man brought his 92-year-old mom to our hospital because we were renowned for our outcomes. She had some pneumonia and was placed on a ventilator, breathing machine, to help her breathe. Numerous antibiotics and drugs were given to help the lady as her son wanted, quote-unquote, everything done. She stayed on our unit for weeks, breathing and eating through tubes with incredibly advanced dementia. Every time we came into the room or spoke to her, you could just see the fear in her eyes. Every time we had to turn up her ventilator settings, as she got closer to dying, we talked to the son about withdrawing care, but he denied. Never. This was his mom, and he didn't want to let her go for any reason. Yeah, at a certain point, this is just selfishness. She's ready to go, dude. She's been ready to go. I told my wife, as soon as it's not fun anymore, you take me out.
I want the plug pulled. Yeah.
Ma'am, your husband's not dying.
He started yelling at the staff, and we had to escort him out a few times. Yet, since he was appointed as the decision-maker in her living will, we had to continue to ask him to make decisions about his mom's care. When his mom was literally days away from death, maxed out on every drug we could give, we asked him to withdraw care on his mom, and he punched me in the face. Later that day, we performed CPR on his mom, breaking 4 of her ribs, and she died anyways. The rest of the family watched us do this in horror to their mom because the son could not withdraw care. When you are appointed to make decisions in a living will, it can only be up to you. We could have withdrawn care weeks earlier, giving her a peaceful and restful death. If we're all going to die eventually, we should have the respectful choice to decide when we no longer wish to be cared after. It's therapeutic. Sometimes enough truly is enough. TLDR, ask your parents what they want and under what circumstances, and please, fight for that. I mean, maybe that's exactly what his mom told him. No reason to punch medical staff. What the fuck? I guess he's kind of a maniac already. I definitely don't want to be kept alive on machines and feeding tubes. You let me go when the time comes. My mom, my wife, myself, we all opt for that, okay? Just in case I become a vegetable or something, go ahead, pull the plug, it's fine. It's fine. I look forward to the next great adventure. Anyway, kind of another dark one, but it does have a good message behind it. You gotta know when to let go. But I can't let go of this quite yet. KM86 says, I work as a paramedic in Canada, more specifically Ontario, and we were dispatched to a call by police for code 4, emergency, code 5, obviously dead, and requested to bring a box of N95 masks. My partner and I were quite confused, but did as we were told. When we arrived on scene, a police officer met us outside, and when I handed him the box of masks, he looked significantly relieved. My partner asked what was going on, and the officer directed us to the door. Within 2 steps of where we were, we began to smell it. That oh-so-obvious smell of death. Death that had had time to fester. At this point, we understood the request for masks, and as we poked our head through the door, we were greeted by a clearly deceased human being, we're assuming. It was a woman who probably weighed on the lighter side of 400 pounds, when she was solid, at least, which, at this moment, she was no longer. Oh, God. Just liquefy on your own couch? Jesus. I am handing in my letter of resignation today. The officer proceeds to tell us that she hadn't been seen or heard from in 2 weeks, and when someone finally came to check on her, they found her as a puddle. To make matters worse, she had her heat blasting. It was the middle of summer, and temperatures could get up to 30 degrees Celsius, or 86 degrees Fahrenheit, and she had all her blinds open and was seated in direct sunlight. It was probably the most disgusting sight I had ever seen. Well, what you need to do is get a team of cats in there to eat her face. Easy cleanup, no fuss, no muss. I mean, it is a human being, and I'm sad you turned into a pool of liquid. Nobody even cared to check on him for 2 weeks? That's even more tragic. I demand that when I die, somebody notice it the day of. I might be a recluse, but I'm not invisible, for God's sake. Yeah, it's pretty nasty. But maybe she's on to something better. I don't know. OK Common Eat says this wasn't so much what had happened, but what was said. I worked in the nursing home as an aide and was putting one of my favorite residents to bed for the night, and I go to leave the room. She's on alarms because her dementia's so bad she thinks she could walk on her own, and it goes off. I turn around and help her do what she's getting up to do, and as I'm tucking her in again, she stops me and says, "Jamie," her son's name, "you can have the money, just don't beat me. It's not about the money, you can have it, just be a good boy and don't hurt me." TLDR, sad face. I mean, is that how dementia works? Is that like a real event that occurred for her? Maybe it is. Maybe it's a delusion. We choose what things to believe in this life, and I'm going to choose to believe that that was a delusion. Although Jeremy did stick his mom into a nursing home, which, not a great look. I think we should all get together and enact some revenge on Grandma's behalf. What do you say, fellas? Some ReddX Industries brand lead pipes, huh? Lornad says one of the most horrifying things I've ever seen in the hospital was a guy who OD'd on one of his prescription medications. One of the side effects was priapism, erection lasting more than 4 hours. Once the doctor got his cardiac and respiratory rates relatively stable, they tried to get rid of this poor dude's erection, which was starting to turn purple, black, blue. Uh-oh, that's not good. After several non-invasive methods, they did what they had to do. They had to inject drugs directly into the head of his dong. Not one shot, not 2 or 3 or 4, 19! 19 injections right to the head!
That's gotta hurt!
It was still swollen, bruised, and red 2 weeks later. I just posted this in another thread, but it fits a little better here. Don't hate me for the double post. No, that's fine. As many people as possible should know about a dude that got 19 injections. To the tip. Just right to the tip. I guess it's better than your dick falling off, though. I don't know. If I have to choose. Deleted user says, I'm a pre-med hospital volunteer in South Central Los Angeles, and one night while in the ER doing my volunteering, basically following a physician around, a man came running in and collapsed. The nurse explained to me that this was something known as the homie drop-off. Basically, this guy got his neck slashed with a blade, and his friends found him. They drove him to the hospital, dropped him off, and bounced. That was the first time I had ever seen so much blood squirting out of a human's throat. I'm not sure if he made it or not, but I trust that my hospital's nurses and physicians are experienced enough to save his life. Nonetheless, I still enjoy working in the ER. Yeah, welcome to South Central, I guess. Some shit happens down here. Gotta keep your head on a swivel. User based on content says, I did not witness this firsthand, but the most disgusting medical related story I've heard from a practitioner who actually lived to tell the tale. As part of my training to become an unwanted intimacy crisis counselor, a doctor came in to give a presentation about STDs and STIs. Somehow he veered off the main topic and starts telling us about all the things that he's seen in his time. A female patient came in complaining of extreme abdominal pains. The patient disclosed that she was a lady of the night. The patient further disclosed that in order to continue working while she was on the rag, she put a sponge as close to her cervix as possible to absorb the blood and other mens-related discharge. The patient then explained that she had inserted a sponge and was unable to remove it. Is this normal? I don't think it's normal. You're not supposed to do that. The doctor figured it would be a routine matter of removing a foreign object that had become lodged or stuck, and takes the patient into an exam room to perform the extraction. When the doctor went to remove the sponge, it turns out that the patient had been using a car washing sponge to absorb her discharge, and that the same sponge had been in her for 3 months. Oh my god. Oh my god! How'd you get it up there? And also, I'm scared to take it out. When the doctor finally managed to remove the car sponge, which had turned into a black, semi-solidified mass due to the excess absorption of the nastiness, it also released a torrent of fluids that had been marinating inside this woman for 3 months, and the fluids gushed out and nearly covered the entire floor of the room. My spine! Yeah, Swamps of Dagobah didn't do it for me, but that story right there. Oh my god. Hate it. Whew. The doctor told us that it was the first time in his 20 plus years of practice that he actually vomited while performing a medical procedure. Who wouldn't? And that the stench from that room was so foul and pungent that it filled the entire clinic and made a seasoned nurse who was standing in the hallway also puke. As the doctor was retelling this horrifying life tragedy that he survived, he didn't look a single person in the eye. His eyes were transfixed on some non-existent point near the horizon of his traumatized memory. TLDR, doctor pulled a car washing sponge out of a working girl who left it inside her for 3 months. God, dude. This is the worst thing. This is the worst. What? Why are you doing these things? Oh! I guess I understand you gotta make the money, you know. You stick the sponge up there, but let's pick a smaller sponge, first of all. And then second of all, make sure it comes back out. Leave a little fishing line tied to your finger or something. I don't even know how to process this. Oh, it got me so good. Should I roll the dice on another one? I don't think I'm gonna roll the dice on another one. I think we've all had quite enough today. But yes, what a feast indeed. The cringe abounds. I bookmarked this thread. We might come back at some point in the future. It's old, but there's probably similarly titled threads that have some good replies in them. Don't sleep on AskReddit, although I often do. Anyway, I hope you enjoyed this episode, friends. Let me know by commenting or liking the video. You can also sign up on the Patreon. Oh, look at all those names. Those are all Patreon names. And then the YouTube members, they coming up next. You guys have been absolutely killer with the support. I really can't thank you enough. I'll keep cranking out the cringe. And thank you guys for showing up for your daily feeding. I hope that you will always remember, friends, that you are loved, you are worthy, you definitely deserve it, and stay out of the hospital. And until the next time, friends, bye-bye. Her chart had noted that she'd been injecting IV substances through her perineum. Perineum? Yes, thought the perineum was lovely. And at the exact same moment, the patient had a much... The patient...